is Dr. Trudy Ufondu of Snowspirations, Global Health Solutions, and it's actually an amazing day. Today is the 24th. Today is the eve of our big event, which is coming up tomorrow. And it's a very big privilege to have this opportunity to talk to you guys about tomorrow. You see, health is not just the absence of disease. Health is the totality of you. And our women need to be in optimal health to achieve their potentials. So for everybody out there, when you are ready to start your family, you have a stipulated physiologic body makeup. So don't mind the big grammar. Physiologic makeup means there's a specific way God wanted you to be. There is a specific body weight God gave you. There is a specific number of eggs you're supposed to use to start your family. But because you're in the society, because you're in your environment, because you're exposed to stress, because you have a couple of things, they can add or remove or put the bad things or remove the good things in your life. This is where health can come in. Now, health might mean that you're not in a good place. If you're not happy, that's your health there. If your relationship is not good, that's your health there. If you're not eating good food, that's your health. If you're not sleeping, that's your health. If you don't have money, that's your health. If you're not happy with your spouse, that's your health. So health is the totality of everything that affects you as a human being. Now, by this time tomorrow, we will be having a build-up to our Super Masterclass event. So it's going to be Healthy Woman Super Masterclass. Anytime you see super, there is something extraordinary you're going to experience. So please, you still have a chance to attend this amazing event tomorrow. It's going to be by 9 p.m. Nigerian time. It's couple friendly. So please invite your partner. Make sure you're not attending alone. What we're going to do tomorrow is going to be practical. The external guest presenter, it's an experienced, school of thought in this regards. She's an amazing coach. She's a world-class coach. She's Nigerian. She's changing lives. She's going to come with her tools. She's going to take us through the steps. What are those lifestyle modifications you're supposed to engage in? Thank you so much, my dear. What are those lifestyle modifications you're supposed to engage in? What about your food? What about your exercise? What are the things you can derive joy doing and at the same time you're living healthy? That's what we're going to talk about tomorrow. Now, today is the deadline for this event. It's an event that will change your life. It's an event I will personally encourage you to attend. Your life will not be the same. Now, it's possible that the reason why you don't have your baby today is because you've added a lot of body weight. Now, the best way to check to see if you are actually within a healthy body weight is to check what we call BMI. Your BMI will take your body weight, take your height, plug them in, then it will give you the range. The formula for your BMI is very simple. This is about the simplest mathematics you can make in your life. Check your body weight in kg. Check your height in meters. Now, when you plug your body weight on top, that's the numerator. Then you plug your height below. That's your denominator. Your body weight in kg over your height in meters squared will give you a kind of inkling of your BMI. Your BMI stands for body mass index. It will tell us if you're underweight. So if your number is below 18.5, you are underweight. If your number is from 18.5 to 25, you are within the normal range. So this is exactly where we want all the women that want to become pregnant to be in. If your number is above 25, but below 30, you are overweight. If you are above 30, it's obesity. We don't want you to be there. Now we can use this to begin the journey of reclaiming our life. The beautiful thing about your health, when you get your health back, you're going to get your vitality back, you're going to get your fitness back, you're going to get your sleep back, you're going to your blood pressure is going to be okay, your blood sugar is going to be okay, and ultimately, the only thing you need to do naturally to become a mother, which is love making, will also increase. So there are so many benefits you're going to get. So this will be a great opportunity to begin the journey. Most of things you need to do, you don't necessarily need to go and be taking this drug or doing this magic to become who God said you will become. And it's important for women above 35 to take this bold step. Why? Because as you're aging, your fertility index is reducing. But if you increase your health, even if it's only one egg you have, your one egg will be of good quality, because the key word is quality. In as much as we need quantity, we are actually more interested in what? Quality. So I will strongly encourage this class for the family. Now, in some families, they are struggling with childhood obesity. If you are living healthy, the possibility your healthy life will trickle down on your kids is very high. If you binge on ice cream, if you binge on cake, the possibility your kids will copy you is very high. As the woman in the house, you are the custodian of what your family will feed on. So what you buy, your family will eat. What you keep in your food pantry, they will eat. What you put in your fridge, they will eat. If you adopt a healthy lifestyle, you will get there. The beautiful thing about our coach, who is also very, very interesting lady, you can see a couple of our clips out there. She's going to walk the walk with you. She's done it before. She's doing it with a lot of people. So this is an opportunity to come for us to fellowship. Now, if you've already registered for the class, please do the right things. Send us email. When you receive our email, there's a link there. Please click on that link. Make sure you're added. The class is going to start 9 p.m. prompt. Show up at least 10 minutes so you can make one or few adjustments. Close all open applications. Make sure your partner is in attendance. Back each other up. So let your partner open maybe iPad, desktop, laptop. You open your phone. If you're using your phone, the possibility you're going to be distracted is there. So look for avenues to back each other up. But for whatever reason, attend this class. This class is going to put you on the right track to regaining your flat belly, regaining your fit body, regaining your happiness. And when we are doing this, we're not just doing this because we want you to have babies. We are doing this because you're reclaiming your health. So the Healthy Woman Super Masterclass is tomorrow. It's going to be a great event that will give you an opportunity to participate fully. Okay, so I appreciate you guys, and I want you to be there. Please go. If you love rush hour, you can actually beat the deadline. The deadline is today for Nigerians. You can beat the deadline, but the onus of being properly registered is on you. So it's not just enough to say, oh, Doc, I registered, but nobody added me. Nobody's going to come to add you. So make sure you're added. But it's a class that will help you to become who God said you become. Even your ovulation. If you added extra body weight, you're not going to be ovulating properly. If you lost an excessive body weight, you're not going to be ovulating properly. So we don't want it to be low. We don't want it to be high. We want it to be in the middle. The something is applicable to men. Some men are having problems with what? Their sperm count, low sperm count, poor motility, poor morphology. You've been gulping so many multivitamins, but the only thing you need is to lose your body weight. What happens when you lose your body weight as a man? Your testosterone, which is the sex hormone, will be within normal range. What happens when your testosterone level is within normal range? You are going to have increased libido. What happens when you have increased libido? You will increase the frequency you need. Remember, the natural formula in our group is PPP. Pray, play, practice. If you can pray to God, which I believe you've done today, if you can correspondingly play 48 hourly. So if you made love with your partner today, you have a break tomorrow. Monday, you resume. You break on Tuesday, you resume. This is how to get the result you need naturally. You might have been taking a couple of drugs your body need, but this is the moment you've been waiting for, and I'm encouraging you to keep on keeping on. Now, if you haven't joined our group for whatever reason, please follow my admin. My admin is going to share the link. She's actually shared the link to join our group. When you click on the group, you will enter automatically. We also have a page, so make sure you join the 2 pages. If you also want to subscribe for the event tomorrow, they've also shared the screen. What you need to do is to get Crash. You can get there. Okay, so right now, I'm going to give you an opportunity to ask your questions in real time. And thankfully, I'm going to see your questions, and I'm going to give you a feedback. Okay, so the clinic is open. In the next about 30 minutes, I'm going to take care of your questions, okay? So let me see what I have. Okay, for some reasons, it's not showing on my page. This particular, we're trying to experiment on a couple of things, and for some reasons, it's not showing on my page. Let's see what could have happened. Yeah, I'm gonna keep it from you. Come on. Yeah, so we're gonna rectify this admin, but for some reason, one of our pages which I'm supposed to be showing on is not showing. But let's quickly see what we can cover. And we can come back much later today. So by 8 p.m. US time, we're still gonna come back to kind of do one of you backup and fix with the guest presenter. So maybe by then we can fix this. Correct. Lillian from Abuja, thank you for coming. Let me know where you're coming from. Follow the formula for BMI. It's gonna help you a lot. Betty from Uganda, Chiazoka from Boston, Uju from Starlighter, Lagos. When you come in, let me know who you are. If you need to subscribe, please just go through the protocols and we'll be there for you. So please, if you have any questions, go ahead and ask your questions right now. If you need to attend the Super Masterclass tomorrow, please follow the link, send email, follow through with your email, make sure you're added. Okay? Correct. We are gonna fix it, and don't worry about it. Now, guys, go ahead and ask your questions. Please ask your questions. It's open clinic. It's an opportunity to get feedback from me. This is live and direct. So if you have had questions you need feedback on, if you are struggling with your body weight, you can get help. If you're in America, if you're in Canada, if you're in Australia, if you're in UK, you can attend. Let it not be an excuse. Come, let's fellowship. If you also need personal consult, also do the right things. We have a couple of packages. We have light package for 1 week. We have basic package for 1 month. We have classic package for 3 months. And we have prime for 6 months. If you ask me, the best package for you is 6 months. Why is 6 months important? You can actually become pregnant. When you become pregnant, you can actually still have that your subscription running. But when you come in briefly, you can come in for 1 week. When you're done with 1 week, you're going to be automatically out of my reach. When you're done with 1 month, you're going to be automatically out of my reach. So if you eventually become pregnant, it will benefit you more to still be in my link. Okay, so remember the motto of the group, PPP. We pray a lot. We play a lot till we make love every 48 hours. Then we practice a lot. So what's practice? Practicing everything I've been teaching you guys, attending your master classes, daily broadcast, subscribing for medical consult, seeing your fertility specialist, getting your PDFs, doing the right things. If you can do this on daily basis, you're gonna get help. Okay, so guys, ask me your questions, okay? This is an opportunity to ask your questions. Osinachi from Poraka, thank you and welcome. Stella from Lagos, thank you and welcome. Nkechi from Lagos. Oluchi from Germany. Okolie from Asaba. Guys, keep asking your questions. Please, if you need to subscribe, the admin is sharing the details. What we need is action-oriented feedback. So find what you can afford. If you can afford 1 week, 1 week can change your life. If you can afford for 1 month, why not? 1 month is a lot of time. If it's 3 months, why not? But take your steps today, not tomorrow. Use the opportunity you have today. But guys, I have a few more minutes and I can give you feedbacks. Remember, if you are already pregnant, please don't go alone. Pregnancy is a long journey. You do not want to go that long route and you don't get the help you need. There are a couple of things that when you see in your pregnancy is a danger sign. Anytime you are bleeding in pregnancy is a danger sign. It's possible that your baby is about to be aborted. It's possible it's dehydration. It's possible it's hormone imbalance. It can be anything, but don't sit back. Bleeding in pregnancy is abnormal. When you're bleeding in pregnancy, something we don't want is going on. What do? You pick your phone, you call your doctor, and you're going to the hospital immediately. In the same vein, when you are confirmed pregnant, through urine, please step up to blood test. When you're done with blood test, please step up to ultrasound. Ultrasound is the clinical evidence that you are pregnant. If you are pregnant only by going through the urine, you haven't gone for blood test, it's also not good. Why is your blood test important? Your blood test is both qualitative test and quantitative test. Your blood test will give us the exact level of the beta HCG hormone, beta human chorionic gonadotropin. That's the so-called pregnancy hormone. It's expected that when you are pregnant, every 72 hours, you will have a doubling of your beta HCG. Now, unfortunately, some women can have pregnancy that might not be viable. So you can have missed abortion, you can have blighted ovum, you can have chemical pregnancy, you can have molar pregnancy. When you have any of this I mentioned, or you can have a ectopic pregnancy, when the levels of your hormone is not corresponding with what we have, it can be a link to investigate further. But ultimately, every pregnant woman should go for their ultrasound. Why do you need to go for ultrasound? Because when you go to ultrasound, we will see that the baby is developing inside the womb. That's the original place your baby is supposed to be developing. If your baby is developing any other place outside your womb, it's called ectopic pregnancy. It's an emergency. We need to find that baby. We need to end that pregnancy, possibly cut off that tube. If you have this, you can actually die. So let's take this serious. Now, if you are already pregnant, we have a special place for you. It's called Snowspirations ANC Lounge in Telegram. We also have a special group for women that will become mothers. You've actually missed, if you're not pregnant now, you've missed becoming mother in 2021. You are going to be a mother in first quarter of 2022. The women that will become mothers in 2021 would have become pregnant by January up to February, because an average pregnancy will take you about 9 months. So these are the things we can do for each other. And I'm so excited about the new mothers that God is going to give us in this group. So please go ahead and ask your questions. Okay. How long does pregnancy test positive after ovulation? It's important to understand your body as a woman. So there are a couple of things you have to know like the palm of your hand. Number one, your cycle days. So what's your cycle? So your cycle is the interval between the 2 months you bled. So if you bled on the 30th of March and you're bleeding on the 27th of April, what's going to happen? You count the number of days between the 30th of March and 27th of April. That's your cycle. If you repeat that in April and you compare it with May, if you have a regular 30-day cycle, that's your regular 30-day cycle. Now, when you're checking, don't go freaking about. It's a range. If you can have 21 days, every 21 days you're bleeding, and every 35 days you're bleeding, that's your normal range. Now, besides that, it's expected that a woman should bleed from 2 to 7 days. So if your bleeding is only 2 days, it's on the lower limit of normal. If you're bleeding up to 7 days, it's on the upper limit of normal. The problem is when you're bleeding only for 1 day, or when you're bleeding more than 7 days. Now, when it comes to pregnancy test, it's advisable that you check for pregnancy test 7 days beyond the period you're anticipating to become pregnant. That's the period you will have an appreciable number of the beta HCG to give you test outcome. Now, some women might be in a hurry. They can check too early. They might begin to freak out. They might begin to think they're not pregnant, meanwhile they are pregnant. And in pregnancy, you don't need stress. Stress is your biggest enemy in pregnancy. So please, if you're believing God to become a mother, or you're looking towards becoming pregnant, allow 7 days beyond the period you're anticipating to see your period before you check. When you check and you are pregnant through urine, don't end there. Step up, go to the hospital. We need to know the blood. When you're done with the blood, we need to make sure the baby is okay. You need to go for ultrasound. Once you have done all this, register for your ANC on time. Every pregnant woman must go for their ANC. ANC is the life insurance. In our group, we have an online platform where you need to register for one-on-one ANC. Someone needs to be seeing you. Someone needs to be giving you an appointment to make sure that your baby is developing okay. So the lady that asked about pregnancy test, 7 days beyond the period you're anticipating to become pregnant. Now, there's a concept we call fertility window. Fertility window is when you have the biggest potentials of becoming pregnant. So the closer you are to your ovulation day, you actually have a better chance. But because sperm can last up to 7 days, we actually take it up to 5 days before your ovulation. So your fertility window opens from 5 days before your ovulation and ends a day after. So that period of 7 days is the period you have the best chance of becoming pregnant. But guess what? In our group, we don't preach ovulation sex. We don't preach timed intercourse. What do we preach? 48 hourly. Why is this important? It's possible you're having irregularity. If you are having a baby problem, if you wanted to become a mother for the past 10 years, you're not a mother. For the past 5 years, you're not a mother. The problem is not the timing. The problem might be because the period you think you're ovulating, you're not making love within that period. So what do we preach? Regular, routine, unprotected sexual intercourse, 48 hourly. This is how you can defeat infertility naturally. Okay, so Okolie Chinanye, please use that to address the concern you have. Guys, if you have questions, please go ahead and ask your questions. Doc, does myoma cause secondary infertility? What's the answer? Yes. Remember that your myoma is the same thing with fibroid. We call it, medical people, we love calling big names. So anywhere you see leiomyoma is fibroid. Anywhere you see myxoma is fibroid. Anywhere you see myoma is fibroid. They are just beating about the bush. They are the same thing. Now you're asking if myoma can cause secondary infertility, and the answer is what? Yes. The criteria for myoma to cause secondary infertility is dependent on the size, location, and symptoms. So there are 2 types of myoma you should be conversant with. Any of the fibroids inside your womb can affect the ability of becoming pregnant. Why? That's where your baby will implant. So if you have intramural fibroid bigger than 5 cm, or if you have submucosal fibroid bigger than 5 cm, they can impact your ability to become pregnant. Even when you become pregnant, they can lead to miscarriage. Some fibroids can damage your womb to the point you will need hysterectomy. You do not want this. Any woman looking for a baby, if we give you a diagnosis of fibroid, please remove your fibroid. You want to try on an empty womb. You don't want anything occupying the space where your baby is developing. It's not going to help you. So make conscious effort. Now, I understand so many people are afraid. You've had your friends dying from surgery. Why did they die? Because it wasn't done right. Because precautionary measures were not done. But myomectomy, which is the surgical removal of your womb, surgical removal of your fibroid, it's the commonest and the simplest gynecological surgery, but it's a major surgery. So before you go to put yourself under the table, make sure you have due diligence, make your inquiries, make sure the provider is experienced. Don't be a guinea pig. Don't present yourself to people that will use you to experiment. Ask a lot of questions. There are so many people that die simply because of knowledge. There are so many people that don't have babies today simply because you don't know what to do. This is the era of knowledge. And so long as you belong to this group, you can get what you need. Now, secondary infertility means in the past, you got pregnant. Either you had a baby, or the baby got miscarried, or you had stillbirth, or you aborted the baby. But currently, you are not able to have a baby that have never been pregnant, and still up to now you're not pregnant. It's called primary infertility. So how can secondary infertility happen in myoma? If previously you had your baby, you didn't develop fibroid, then subsequently you develop fibroid, and that fibroid become a factor. And unfortunately, women of African origin, majority of them will have fibroid, and we don't know what leads to fibroid. But we know there are some risk factors that can predispose you to developing fibroid. One of which is what? Unhealthy ligament. So you need to attend the event tomorrow. Very, very good question. I love that question. So guys, keep asking your questions. Keep asking your questions. I don't have a topic. I'm just going to pick your questions and make sure everybody is good. If you need to calculate, estimate your ovulation, Follow Chi Evelyn. She used a formula. She used an example of a lady called Chioma to help you do this. Now, even if you know how to calculate your ovulation and you know your ovulation is coming tomorrow, when you have made love tomorrow, continue making love. Don't just wait to make love on your ovulation, because guess what? That day might not happen. It might have come before or it might have come later. So stop timed sex. We don't encourage that because it's a waste of time. Okay, guys, keep asking your questions. If you need to subscribe, click on the ANC for pregnant women. If you need to be in our Believing for Baby category, please click there. For individual consult, you can come in for Prime for 6 months. When you come in for 6 months, you will have opportunity to talk to me. I can talk to you, I can talk to your partner. We can both be on the same page. You can achieve this through your 6 months, or you can achieve this through your 3 months. You have to take your actions. Pregnancy is meant for every woman, but sometimes you need to step up your game. When you have said your prayer, you need to do your own part. God is going to make everybody a mother. God is going to make everybody a father, but we need to do our own part. Okay, Doc, please, is it normal to bleed for 7 days? Yes, 7 days is the upper limit of normal. But when you begin to bleed beyond 7 days, there's a problem. You need to see a gynecologist. If you're bleeding for just 1 day, that's also abnormal. So the normal bleeding day is 2 to 7 days. Okay, good evening. Please make sure your questions are very brief. Good evening, please. Doc, you have several menstrual pain with vomiting, stooling, together with heavy bleeding, several tests, and you've done an accept pain, okay, and diagnosis of endometriosis. Unfortunately, it can happen. So what happens in endometriosis? You see, the cover of the womb is called the endometrium. That's the only place we expect to see cells from the cover of the womb. Now, when we begin to see those cells that ordinarily should be in the cover of the womb, any other place in your body, they can bleed when your period is coming. But unfortunately, because there is no exit, when they are bleeding, they're not going to come out. Excuse me. Very, very painful condition. Unfortunately, what you're presenting with looks like endometriosis. Now, we have different grades. So it can be mild, moderate, or severe endometriosis. So you need to follow up. Okay, so they book you for surgery 19th. Hope everything okay. In any way, correct. Unfortunately, endometriosis is a factor that can affect your ability to become pregnant. So you need to be under a specialist, a fertility specialist. Okay, anytime you have gynecological problem, you can no longer do it by yourself. You need help. Please, my people, listen to me. It will not pay you not to get help and only be praying. Believe me. Look, I'm keeping it real. Don't just waste time you don't have. Step up. The criteria is 1 year. If you are below 35, you and your partner are doing the right thing. Unfortunately, people are not doing the right thing. Once you have passed 12 months of regular, unprotected sexual intercourse, at the 13th month, you have infertility. If you are 35 years and above, and you have done this for 6 months, at the 7th month, you have infertility. That infertility can be male factor, it can be female factor, it can be secondary infertility, it can be primary infertility. We need to know. Until we know the cause of your infertility, is a blind protocol. You don't want to be beating about the bush. Okay, so guys, let's see what we have. Ask your questions. Ask your questions. Please, Doc, what are the possible causes of missed abortion in first trimester? Unfortunately, missed abortion is a type of miscarriage, early miscarriage. How does it present? You didn't bleed, you didn't have pain, but the baby in your womb is no longer viable. The baby died inside, but you didn't have the visible evidence that you miscarried. So it's a missed miscarriage. Remember, in medical practice, miscarriage and abortion are the same thing. Okay, now the majority of this problem is caused by chromosomal problems. Majority. Now, some can be caused by hormonal issues, some infections, some abnormalities, but we don't know. But most of them are caused by chromosomal problems. And unfortunately, there is nothing you can do about it. It's going to happen. It's going to happen. Okay? Okay, let's continue. So if you're in Oka, if you're in Abuja, if you're in Enugu, if you're in Benue, if you're in Calabar, if you're in Jos, if you're in Kano, Kogi, Lagos, Nnewi, Osun, or wherever, we can refer you. If you need by the neighboring state or community, and you're not in Lagos, but you're in Ogun State, but you can go to Lagos, please go. People go from America to Nigeria to get results. Don't allow distance stop you from getting the help you need. If you need to speak with me, you can come in at 6 months or you can come in at 3 months. It is possible. I can speak with you. I want to speak with you. I want to help you. But you have to help yourself. And please discuss this with your partner. Sometimes your partner might be in plan B, you're in plan C. It's always good to have one game plan. Your infertility is a temporal challenge in your relationship. Don't allow it damage your relationship permanently. Okay, guys, keep asking your questions. I have few more minutes, so we can go get ready for tomorrow. Tomorrow is the big day. Okay, Doc, when a scan result mentioned that fundal intramural fibroid seen 2.8, 2.3, ordinarily, I don't normally attend to this kind of question because it's personalized, but I'm just going to use this to teach for teaching purposes. Please stop sharing your medical info openly. It's against what we call HIPAA here, okay? You can be in trouble personally. Your relationship can be in trouble. Your partner can sue you for anything. So be careful. If you need me to attend to this way, subscribe so I can see what I can do for you. Okay, but you have fibroid. Now, 2.8 and 2.3, they are not big, but you have it. It's inside your womb. So that's a factor. Okay, so we need to see what we can do about it. Now you have low segment intramural fibroid. That one is appreciably big. If you approximate, it's 5 cm. So the problem with fibroid is the fact that if you don't deal with them, the possibility of it getting bigger over time is there. That's the problem. So you need to meet your gynecologist and we discuss what we need to do. How good is folic acid when you want to get pregnant? Are you kidding me? This is like asking fish, how good is water? You need your folic acid. Remember that your folic acid is not a fertility drug. Your folic acid is a preventative multivitamin. So you need it to make sure that eventually when you become pregnant, the neural tubes, which is a place that takes care of your baby's spinal cord and brain, will be properly developed. So you're taking it to protect your baby. Now, it's advisable to start taking it 3 months before your pregnancy and 3 months into your pregnancy. So that period of 6 months, it's a must. Now, personally, we encourage all women making love without protection to start taking their prenatal multivitamins. Why? Sometimes you won't even know you're pregnant, you've advanced. When you miss taking your prenatal multivitamin, especially the folic acid component, you are putting your baby in danger. The danger your baby is going to have, we can prevent them. So take it religiously. Okay? Okay, let's continue, guys. Can you register for the program tomorrow? That's called rush hour. So run, you can register, but you need to run. And when you register, keep an eye on your email, because you are the person that will add yourself for. Nobody is going to come and wake you up. So this is part of responsibility. You don't want to pay for any of our services. Recently, I had a lady that showed up. She subscribed in July last year. Now she came in and she was telling me cock and bull. Look, my people, we need to be responsible. Money is hard to come by. How can you register and you forgot yourself? Then when your subscription expires, you're coming back. It doesn't make sense. So please, if you're registering for tomorrow's event, please attend. If for some reason you're not able to attend, it's still okay. You can review the video and you will still have the PDF. But there is this joy you will get by the time you participate. Look, if you haven't seen this lady, you will not understand. If you don't like your body, if you are so ashamed of your body, if you've lost your confidence, if you're no longer able to open yourself to your partner, you have a problem. Come, let's fellowship tomorrow. This is no joke. It has happened before. You might get the help you need. So come, let's fellowship. Can myoma be removed during childbirth? Now, in some special centers, some providers have tried to do this during CS, cesarean section. But guess what? One of the problems in entering your womb is bleeding. It's always good to stick to one game plan. When you're going for your CS, open the body, bring out the baby, end of discussion. In some centers where they have very high-tech specialties, they can go in there, in cost of removing the baby, they can remove the fibroid, but it's not generally practiced. So what you need to do is to do the right thing. Remove your fibroid before you become pregnant. Okay. The same thing I've told you guys about Mr. Abortion can happen to, molar pregnancy can happen to, chemical pregnancy can happen to, anabionic pregnancy, which we call blighted ovum. Unfortunately, it can happen to anybody. It's not because you committed sin. It's not from people in the village. No, it's called life. It can happen to the best of us. Okay? All right, guys. Keep asking your questions. Okay? Keep asking your questions. If you want to get crashed, please follow the admin and subscribe. Please, look, this is a one in a year event, so you don't want to miss this. Please come. We will help you. Okay? And if you love what we are doing, tell your people about the good news. We love you guys. We come in for free. My intention is to help. So share our page, share our group, tell people about the good news. You can get help. Okay? Please, what are the possible causes of, my sister, I keep repeating myself. Please, what is adhesion? Very, very good question. You see, when you want to lie on your bed is well made, right? You lie on the bed, you have a peaceful sleep, right? Now consider the womb or the cervix having thorns, having cobwebs with sharp edges. Now, for some reasons, when you go for procedure or when you have PID, pelvic inflammatory disease, they can damage the cover of your womb, or because of previous surgeries, then you have what we call scar tissues, rough tissues, cobwebs, thorns, covering the cover where the baby is supposed to develop when it's implanted, or covering your cervix. When this happens, the sperm cannot easily come in, or when the sperm come in, the baby cannot implant in your womb. So anybody that has extensive adhesions, you need to go for surgical removal of that adhesions. Now, some people can have what we call Asherman syndrome. It's possible that in the past, when you were growing up, you didn't want to have the baby, you aborted the baby, or you had evacuation, but the place you had this, they overzealously scrape off the thick layer of your womb. Now, when the womb is healing, it will heal with these scar tissues. And when you have scar tissues, it will affect your ability to become pregnant. That's called adhesions. So if it's confirmed you have adhesions, then you need to go for minor procedure to remove them. When you remove them, you will increase your chance of becoming pregnant. Okay, let's continue, guys. Let's see what we have. How do you register? Follow the admin. Why does fibroid grow back after surgery? Fibroid doesn't grow back. So what happens? Fibroids can have different sizes. So when they are going in to remove the 8 cm, 9 cm, 6 cm, 5 cm, it's possible that you have about 1, 2, 3 cm growing. So when they were doing that myomectomy, they didn't take care of the little ones. So over time, the little ones will become big. Unfortunately, some women have had 2 myomectomies, but that's what happens. Once you remove something from your body, it doesn't regrow. Okay? Let's continue, guys. Let's continue. Ask your questions. Ask your questions. Please ask your questions. I will be wrapping up any moment from now. Okay, I've already mentioned the effect of folic acid in preparing for pregnancy. It makes sure that the neural tubes are properly developed. Before you become pregnant, you're supposed to have adequate stores of folic acid and other multivitamins. When you don't have adequate stores, what happens? You are not going to have good effect because your baby might develop spinal bifida, a type of neural tube disorder. So you need to take it religiously. What's the cause of pain in your navel during menses? So some women ordinarily during their bleeding, because of a couple of things that happen, a couple of chemical reactions in your body, you can bleed. Is your normal. Now that pain can, sorry, you can have pain. That pain can radiate to your belly button. It can happen to some women. Now, it's also possible you might have inflammation. It's also possible you might have fibroid. It's also possible you might have infection or any other thing. So pain is a non-specific sign. There are so many things that can cause pain, but how do we know you present yourself to a gynecologist? Okay, guys, keep asking your questions. I'm actually going to wrap up. My time is up. So let's see what we have. What could be the cause of off and on sharp pain beside the navel in pregnancy? A couple of things. Meanwhile, remember, if you are pregnant, you have a special place. You have a paradise. Come there, let's fellowship with other pregnant women. Now, pain can be caused by a lot of things during pregnancy. It might be because your wound is expanding. It might be ligamentous pain. It can be gas. It can be inflammation. It can be a whole lot of things. Okay, so how do we know? Well, you go back to your doctor and we figure out what the pain is. Anytime you have pain, pain is not specific. You don't speculate about pain. You don't guess. You don't suppose. We just know. When we know, we can do better. So if you have infection, we can take care of the pain. If it's just something you have to ride, with it, you just have to ride with it. Okay, guys, let's see what we have. If you still have questions, I can still take care of your questions. When I'm done, we're going to get ready for tomorrow. Can a woman of 50 go for IVF? Actually, at IVF, at 50, IVF is your best option. And when you're going, please go with donor eggs. Why? The possibility that at 50, you've gone into menopause is high. Now, if you haven't gone into menopause at 50, your egg reserve is down. The quality of your eggs is down. So then you can become a mother at 50. So even if you've gone into menopause, you can use donor eggs and you can become a mother. So at 50, your best chance of becoming a mother is what? IVF with donor eggs. Can you become pregnant naturally at 50? Yes, it has happened before. But your chances are limited. But you can. God can do anything. But this is what I know, and I'm telling you what I know. If you're 50 and you want to be a mother, you need to step up your game. Some people pray against their families. Some people go to church and say, God, I ban and cast IVF. Meanwhile, IVF is the only option you have. Why? Because your two tubes are blocked. So you don't go to church and you're binding the way God said he's going to use to bless you. How can a 60-year-old woman be binding and casting against assisted reproductive technique? That's the only way you can become a mother. How can you be binding and casting adoption or surrogacy? Those are the only options left for you. You're not 25, you're 52. So your age is important. So at 50 years, there is no time you can be a mother. Motherhood is a choice. If you choose to be a mother, you'll be a mother. Okay? All right, guys, let's wrap up so we can get some rest for tomorrow. Tomorrow is going to be amazing. You don't want to miss tomorrow. If you miss tomorrow, you have yourself to blame. But guess what? If for some reason you're not able to afford it tomorrow, don't worry. It's going to be offered at 50% discount. Now, admin is going to recruit a couple of people. I'm aware we have about 15 people. So we're going to look for people that can attend because they can't attend. We know some of our members cannot attend. So some loving women do bring money together to help women that can attend. So if you are a diligent, caring, loving person that need help, then you can attend tomorrow's clinic. Admin can recruit you. So I don't know her criteria. So she's going to decide and she's going to recruit you tomorrow. So you can attend free of charge. So you have to be on the lookout. At 39 weeks, no sign of contraction help yet. Hope all is fine. So you still have about 3 more weeks. The average period we normally allow pregnancy to get to is what? 42 weeks. But at 39 weeks, your bags should be ready. Your baby can come anytime. Now, your doctor should have a delivery plan. If you are counting down to your EDD, he's going to keep an eye on you. So there is no specific time, oh, you're going to go into labor now. You can go into labor after this tonight. You can go into labor tomorrow. But you are almost there. This is the point you need to be careful. Keep in touch with your doctor. If water is coming out of your body, if you're feeling pain, if you're having show, if you're having bleeding, it's possible your baby is getting ready to come. At 39 weeks, we would have known if your baby is coming with head, if your baby is coming with breech, if your baby is coming with shoulder, if your baby is coming with leg, so we can have delivery plan. At 39. Unfortunately, some people that are not doing the right thing, we will hear the story of doctor, I came to 38 weeks and I lost my baby. We don't want anybody losing their baby because your babies are my babies. I want all my babies intact. Okay? Okay, someone is sharing their testimony openly. This is what we love. Dr. Trudy, thanks for your teaching. You are now a mother after 2 years. Blessing Oketa Odejum Odumu, God bless you. This is a destiny child. So long as you do your own part, everybody will become a mother. And when you are blessed, please show up and tell people about your good news. Okay? Okay, let's continue. Let's continue, guys. Someone is asking about how to subscribe. You see, what I've noticed, Some people will indicate interest. Admin will be running up and down, copying and pasting. Then after they broadcast, they will not subscribe. Guess what they will do? They will come to my inbox. Now, let me be very frank because this is a family meeting. Since 2015, I've had thousands of messages. I haven't even opened it. Look, I could have opened it, but I can't. It's a lot. So consider 2015, 16, 17, 18, 19, 20. I have thousands of messages I haven't opened, but that's not the right way. When you subscribe, you have the right to be attended to. So if you need help from me, don't send me messages. The fact I'm not reading your messages doesn't mean I'm mean, but you need to do the right things to get help, okay? So that's what I would advise you to do. If you genuinely want to subscribe for 6 months, please step up and you will get help. There is nobody that won't get help in this group. Everybody's gonna get help, okay? Okay, Doc, what can you do to go into labor at 40 weeks? Now, the question you're asking me is actually not good. Why at 41 weeks actually? So my sister, listen to me. This is a correspondence you're supposed to be having with your doctor now. You are almost there. Matter of fact, I'm sure you've passed your EDD. If it's accurate that ultrasound gave you 41 weeks, then you and your doctor should be corresponding by now. You should have packed your bags. So your doctor will be deciding, are we going to induce this lady? Are we going to do this? What do we do? If you don't go into labor naturally and you've passed the period and we feel the baby is compromised, we can induce you. We can go for surgery. We can go for emergency CS. So your doctor should be the person that will decide, but your baby can come any moment from now. At 41 weeks, there is no special magic that you will do. There are a couple of things we can do as doctors to see if we can initiate labor. So we can sweep the floor, or we can rupture your water membrane, or we can induce it, or we can section you. But for whatever way your baby decides to come, we're going to deliver the baby. When you are pregnant, it doesn't matter if it's coming to the vagina. It doesn't matter if it's CS. What do we want? A baby. Some people in the past, I want to believe they no longer do this. Some women in the past lost their babies. Some lost their lives. Why? Because they are waiting to deliver like Hebrew women. Be careful. Don't be silly. Stop reenacting things you don't even know about. When you're pregnant, you should be very flexible. If we tell you we are sectioning you, you pray for the doctor that will go to the theater. What do you need? Your baby. Okay, causes of hirsutism. So hirsutism is when a woman is having hair distribution just like men. Now, it can be a sign of hormone imbalance. It can also be a sign of PCOS, polycystic ovarian syndrome. So when you have more level of male hormones, those level of, every woman can have testosterone, every man can have estrogen. But when the level of your male hormones, which you call androgen, is higher than the female hormones, you can begin to present with characteristics of men. So hirsutism is a situation where you have head distribution as if you're a man. When you have that, it might be a sign you might have infertility. So you need help. If you're just joining, I'm just giving a word round and also a pre-conference for tomorrow's Super Masterclass. And if you have your questions, you can quickly ask your questions and we can take care of you and we can go. So we're actually going to wrap up at 50 minutes. I didn't even know I've spent almost 50 minutes. So guys, if you have your questions still, I can provide you feedbacks. How do you go into labor naturally? Things are going to take its course. Okay? Labor is a natural process. When the baby is due, baby is going to go into labor. So that's the natural way. But anytime we are coming to intervene, so if we're augmenting, if we are sweeping the floor, then it's no longer coming naturally. Okay? All right. And if you have your good news, share your good news with us. Okay? Is someone saying they don't want induction? Look, let me tell you the truth, my people. Let me tell you the truth. There is a thin line between Tales by Moonlight and Happy Christmas. As a pregnant woman, if you want to be a guinea pig, if you want to be experimenting, if you want to be holier than Pope, you want this, you don't want this, I want that. Look, my sister, you don't have control. Just yield. Take yourself to the doctor. Let the doctors decide. Some of you are so carefree and so careless about your baby. Your baby is due to come. Then yield. There is nothing wrong with CS. There is nothing wrong with induction. It doesn't matter. We will take care of you. Stop sitting back and arguing. Then when things happen, you begin to cry all over the place. You are your baby's first line of defense. Be wise. Unfortunately, blighted ovum is also, a chromosomal problem. Your chromosomes, when your father and your mother are transferring their chromosomes, somewhere along the line, they had an error, and it can happen. Okay, so in blighted ovum, instead of having evidence that you have a baby, it's empty. You have an empty womb, empty sac. There is no sac, there is no pole, so it's empty. Okay? All right, guys, let's actually wrap up. Can HSG be done 6 months after of trying to get pregnant? So HSG is going to be done anytime so long as you're not bleeding. They will schedule you to do hysterosalpingogram. Okay? So that's one of the routine tests you will do if you're looking for a baby. What will you advise for a woman with multiple fibroids? Go and remove it. You don't have, look, my people, you don't have any business holding to your fibroid. It's possible this is what's stopping you from having your baby. What are you holding it for? And you have a combination of intramural and submucosal. Those are the two significant fibroids that can stop you from becoming pregnant. So go and remove them. You remove them. Okay, someone is asking about Asherman syndrome. So I'm going to explain it in the term you will understand it. Anytime you open any part of the body is going to heal. Now, if your body heals completely, it's called healing by first intention. If your body heals with scar tissues, it's called healing by secondary intention. Now, growing up, you became pregnant. You were experimenting with sex. Then you know your mother will kill you. That's, no, my mother is going to kill you. Then you and your boyfriend will go to one village or behind the scene so-called doctor, and they will remove your baby through DNC, dilatation and curettage. In course of doing that, they can excessively scrape off the basalis layer of your womb. Now, when your womb is healing, it will now heal with scar tissues. It will now heal with adhesions, or what we call synechia. When you have that, the normal surface that everything is supposed to happen so that you can become pregnant will be compromised. So the sperm cannot come in if you have adhesions in the cervix, if you have adhesions in the womb. If you succeed in becoming pregnant, when the baby wants to implant, there won't be a normal place for the baby to implant. So it's a factor that can stop you from becoming pregnant. Okay? Definitely everybody that wants to have a baby is going to get help. So that's what I'm here for. But please go to the right way. If you need personal help, subscribe and I can meet you halfway. Okay, guys, let's wrap up. Let's actually wrap up. The problem is the more I want to wrap up, the more the questions keep popping up. And I don't feel good when I don't attend to all the questions. What causes bleeding after delivery and leads to death of the mother? Bleeding problems. So after bleeding, is expected that what we call hemostasis. So the processes that led to bleeding is expected will control that, right? Now, depending on how you deliver. So if you deliver through the vagina and you're having bleeding, or if you deliver through CS and you're having bleeding, it's called postpartum hemorrhage, PPH. Now, if you bleed excessively and that bleeding could not be stopped, anytime you are losing substantial part of blood in your body, you can die. But my people, this is 2021. No woman should die after delivery from bleeding. We need to find the source of that bleeding and we need to stop the bleeding. And now, if you're under me, if I tell you to give me the report of bleeding, you say, oh, doc is in the hospital. So when you're going to see a doctor, empower yourself, make inquiries, use a very good facilities. You don't want to be looking for a baby, then you see your death. It has happened to so many people. Unfortunately, it can happen. But the reason why you need to have a good doctor, a good hospital is because anytime you're pregnant, your pregnancy can be going okay. We will be thinking we're going to deliver you to the vagina, then you will end up CS. Some women will be in process of labor and their labor can be arrested or contracted or for whatever. Then what do? We run to the theater. So you have to be in a hospital that has a good theater. You cannot afford to play games when you're pregnant. You cannot. And you are not supposed to be alone. You need help. Okay? Okay, guys, we'll have to wrap up this time around. Hopefully, I don't have any questions below. Okay. The lady asking about hairs, I've already explained this. I don't know how else to explain it better. Okay, so hirsutism is a diagnosis we have to tie together. So with the clinical presentation, I also have to take a look at your hormones. So but simply understand that in hirsutism, you have more male pattern hair distribution. You see all those women that have hairs all over their body, their chest, and excessive body hair, we need to confirm. There are still so many women that are hairy by nature. It doesn't mean you have hirsutism. So don't go and misquote me. There are women that their father have what we call afforestation. Their chest is like, hair factory. So by default, you can inherit it from your dad. It doesn't mean you have hirsutism. You can have all your babies. Okay? All right, guys. Okay, let's go, guys. Let's go. Let's wrap up. Okay. Okay, guys. So thank you for coming. I appreciate you for coming. Remember our different clinic schedules, our different clinic schedule. Monday, you will see me on Monday talking to women that want to become pregnant. On Tuesday, you see Dr. Ndiche. On Wednesday, you see me again. On Thursday, you see her. Friday, you're going to see me. Saturday, you're going to see me. Sunday, you're going to see me. Excuse me. The clinic tomorrow is not going to hold because tomorrow is our special event. If you haven't registered, you can beat the traffic. You can beat the deadline. If you want to give yourself a different chance, you can come in. The beautiful thing about our event is couple friendly. So you can use your one registration and your partner can attend. And let me give you an expo. If you have a good friend, right, and you guys live in the same vicinity, if she cannot afford it or you can't afford it, you can go to your friend's house. I'm just giving you a expo. Okay, so you guys can go there and you can put it on a big screen because the lady is gonna do a lot of acrobatics tomorrow. She's gonna demonstrate. I'm even scared myself because I'm gonna be a student. By the time I'm done with my own part, I'm gonna be a student. Look, I also wanna be healthy. Of course, life is good. So register and we'll meet you halfway. Okay. All right, guys. Thank you for coming. I appreciate you guys. If you need further help, admin is gonna help you. And until I see you tomorrow, God bless you and keep on keeping on. Remember, how do you register? What do you want to register for? If it's for tomorrow's event, admin is going to send you the link immediately. If you still want to register tomorrow, if you don't like who you see in the mirror, if your body weight is tilting towards morbid obesity, the problem is when you become pregnant, look, everybody is going to have a baby. Whether you like it or not, you're going to be a mother. You see this mother, father, you will be a mother by force. So. But how are you going to be as a mother? Are you going to live for 5 years and something can come and kill you? Are you going to live for 10 years? Are you going to be around to see the kids that God gave you? If you have good health, you will live long. I'm talking to people in Nigeria, especially some of us are prayer warriors. We pray, but we don't do the right things. We don't see. There are some people, Doc, I don't normally get sick. I'm very healthy. Meanwhile, every week you're going to take anti-malaria and you haven't seen a doctor. But guess what? Every singular woman is supposed to see her doctor at least once in a year. It's called well woman check. Let's get it right. Okay? So get help. If you want to register today, which I will advise you to do, go and register. We want you to come. I would have closed the deadline, but I love giving everybody opportunity. Since today I've been talking from one platform to the other. That's because I want to help. What causes stomach hotness? Well, the presentation can mean a lot of things. It's possible you might have PUD, peptic ulcer disease. It's possible you might have infection. It's possible it might be hormone imbalance. It's also possible it's fibroid. Any of the things I mentioned can cause this stomach hotness. Also, if you are tending towards menopause, that hot flushes can also be a presentation of menopause. Okay, guys, thank you for coming. I actually have 1 more minute to wrap it up to 60 minutes. So One more minute and we're good to go. Okay, thank you so much. Can we all appreciate my amazing admin? I have the best admin all over the world. You can't even beat admin. Thank you so much for running this group. Without you guys, we won't get all the help you need. So thank you for coming. Let me see if there's any other question. Okay, no. So she just shared the last link for people that want to register. And I'll see you guys tomorrow. Come expecting. And remember, every masterclass is an opportunity. Every masterclass is an opportunity to meet with your partner. So get ready tomorrow to consummate. Okay? Okay, my time is up, guys. I see you guys. Until I see you, God bless you, and bye-bye for now. God bless.